Hey, this is Dr. Buzz with Buckeye Physical Medicine and Rehab. That's buckeyepmr.com is the website. Today we're going to talk about hormones, and in particular we're going to talk about female hormones. And unfortunately, there's a lot of females out there that suffer through menopause and aches and pains and osteoporosis and all this stuff. And part of the reason is that females in particular, and when I sit down and talk with females when they come to the office, a lot of females are petrified of hormone replacement. And that's because there's a lot of bad stuff out there. So I'm going to debunk some of the myths today. And I actually have a patient with me who is doing hormone replacement, so she can kind of tell you about her experience. So we are going to cut the break, and we'll be right back.
But you're going to ask me questions, right?
Yeah.
I mean,
Simple question.
don't make me talk
No,
like
no.
makeup.
No, simple questions. He's not going to ask you about what you
Is it
think
weird when
of.
I'm on the radio I don't look at who I talk to? I should probably look at them. I never do.
It would be kind of friendlier.
Yeah, it would
If
be. I don't know
she's
why. I
pretty,
never.
you should.
Okay, I'll look at that.
Just as long as you keep your mouth
Stare
in front of the
at us.
microphone.
Yeah, just don't stare her down like that would be the best.
I don't know why. All right,
I'm hiding behind this paper.
Ready?
I'm ready.
Yeah, here we go.
Hey, this is Dr. Buzz. I'm back. Buckeye Physical Medicine is our place, and buckeyepmr.com is the website. Check us out. But anyways, today we are going to be talking about female hormones. I'm here with TJ. What's up, TJ?
Hey.
She's a female, and she's on hormones, right?
Yes, I am.
But, I want to start off by saying that a lot of females that come to Buckeye that want to do hormones, as soon as I mention hormones to females, a lot of them are just immediately turned off. And, the first thing they think is, oh, hormones cause cancer and heart disease and strokes and all this stuff. And that's incorrect. But unfortunately, there's lots of females that think they're on hormones. They're really not on hormones. They're on drugs that mimic hormones. So we're going to kind of clarify the difference between what a bioidentical hormone is today in comparison to what a drug that mimics a hormone is. Because it's very important for females to understand this. But let's start off by talking with TJ. Tell me a little bit about yourself. So you are a female, obviously.
I am a female. I'm 57.
You had done hormones in the past.
Yes.
And then you stopped. Not with us. This is like a long time ago,
Yeah.
I think.
Mm-hmm.
And then you heard the radio show.
Yes.
And you canceled how many appointments before you came in?
3.
Okay. So if you canceled 1 or 2 appointments, she has the record as of now for doing the show. She canceled 3 times before she actually made it into the office. But so when's the first time you did hormones?
I did hormones when I was going through menopause in my mid-40s.
So like hot flashes.
I had a lot of
all
hot
the misery.
flashes. I was miserable.
Mm-hmm. And that's when most females first start thinking about doing hormones, because I guess the whole menopause thing and the hot flashes are rough. But unfortunately, and you were lucky, you actually did bioidenticals back then, which
Right.
you were lucky to find someone who was doing that, because the majority of physicians don't use bioidenticals. They use drugs that mimic hormones. And just to clarify what I'm talking about there, so typically what happens is a female, you go to your doctor, I'm having hot flashes, right, or this is terrible, and they'll say, oh, okay, well, let's give you Premarin, and that's estrogen, and it's gonna help you so you don't have hot flashes. But Premarin's not estrogen. Premarin's a drug that mimics estrogen. So you have a symptom of hot flashes, and they give you a drug to treat the symptom, but it's not estrogen.
Right.
There's lots of those out there, but Premarin, what we'll talk about for the beginning, that's number one. It's made out of horse pee. I don't know if you knew that. You never took it, so you don't care. But it's made out of a pregnant horse's urine, but it's not estrogen. And there's lots of side effects. It's known to cause cancer. It's known to cause strokes. But this is prescribed. That's why a lot of females. So I think a lot of females that hear these things just think all hormones are bad. So hot flashes are a rite of passage to being an older female, and I'm just going to suffer through it. And that's crazy. You don't have to. You were lucky, so you found someone and you did some bioidentical hormones when you were going through menopause, and did that help you out?
I did, and it did help me a lot. It got rid of the hot flashes right away, and they gave me some creams and different things. I wasn't really that good with it, but I did stick with it for a little while.
Gotcha. Yeah, and then and what she's saying there, so if anyone's listening here, and your doctor told you you're on estrogen, the first thing I ask you to do is look at the bottle and see if it's from a drug company. It's not going to be estrogen. It's going to be a medication or a prescription drug that mimics an estrogen. the only way you can get bioidentical estrogen, just to clarify what bioidentical means, it's identical to what you produce as a female. So you can only take that as a topical. You can't take it orally. You have to have it as a topical or as a pellet that we can put in. But any type of estrogen you take as a pill is going to convert to the bad estrogen. And there's 3 estrogens that females produce. You guys produce E1, which is estrone. That's bad. Then you have E2, which is estradiol, and E3, which is estriol. So there's 3 estrogens. There's E1, E2, and E3. E1's the bad one that causes cancer and strokes and all that kind of stuff. Any estrogen you take, even if you take E2 or E3 as a pill, converts to E1 when you take it through the whole metabolism. So if you're taking any type of estrogen pill, my strong advice is to stop, because even if it is E2 or E3, which I've never seen in a pill form, but it could be out there, it's going to convert to E1, and it's going to increase your chance of having a stroke and increase your chance of getting cancer. E2 and E3 is what we use at Buckeye, and we actually use our combination. We use it's called Bi-Est, and it's 80% E3, 20% E2. And the reason we use that ratio there is E3 is really prevents cancer. Females, when they're pregnant, produce a lot of E3. That's why it's very rare for a pregnant female to get cancer. So that's what we use, and we actually dose our E3 higher than E2, and it's anti-cancer, anti-aging. And anyone who's listening is suffering with hot flashes or any of that menopause stuff, taking bioidentical estrogen not only is going to help you breeze through that and have no symptoms whatsoever, it's totally safe and anti-cancer and anti-aging. So there's no reason. Every female should be on hormones, in my opinion, bioidentical hormones. So you said you weren't that good, though. You were skipping.
Well, what happened was I'm a late mom, and I had just gotten my twins, and I was having hot flashes, and I was just absolutely crazy because the twins were really hard, and so I did stick with it until my hot flashes went away. So I did stick with it for a couple of years, but just the estrogen part. I didn't do the whole package.
Okay, yeah, and what she's talking about, and what we do at Buckeye is females are more complicated. You know this, right?
Mm-hmm.
Yeah.
Yes.
You know, it's very important. Females, estrogen obviously is something that's important for females to take if they're deficient. And everything we're talking about today, when you come in, we do a blood test. The blood never lies. If you're not deficient in something, we don't give it to you. But if you're deficient in testosterone or progesterone or estrogen or DHEA, all we do is restore you to where a normal, healthy person would be. And what anti-aging does is a normal 25 to 30-year-old female is when you're at your prime. Most mental focus, best sleep patterns, best ability to fight diseases. So with anti-aging for males and females, we set your hormones back to what a normal, healthy 25 to 30-year-old male or female is. And that's the goal of anti-aging. So, but we do blood work on everyone, and there's no cookie cutter. Some females need everything. Some just need one. Maybe you might have just needed estrogen back then. I don't know. You weren't my patient. But it's important to do all of them if you need all of them. And people, once again, will say, is this safe? Well, it's no different. If you come to my office and you're vitamin D deficient, it's unsafe not to take vitamin D to restore it where it needs to be. Well, your hormones are the same way. If you're deficient in estrogen, if you're deficient in progesterone, it's unsafe not to restore that back to where it should be. And that's all we do. We simply take it back and put you where you need to be. Mm-hmm. Okay? It's that simple.
Right.
So, and it's not even debatable. You won't find any research study out there, any long-term study, that shows the use of bioidenticals and having any health risk. If anything, it'll show the benefit. Now, I know sometimes on the media you'll hear, bad things about this or that, but those are on drugs that mimic hormones, not on bioidentical hormones. And unfortunately, most people don't even know there's a difference. Most people, they're taking either Premarin or Senestin. There's so many of these things out there. Estrace. These are not hormones. These are drugs that mimic hormones. So if you're taking any of these things and you're listening to the show, or you're not sure if you're taking it, come to Buckeye to consultations where you bring your medication with you, and I'll tell you, if it's bioidentical, great, and you're happy, stay on it. But if it's not, you're at health risk for doing this stuff. So, so then you got off hormones, probably because you had twins.
I did, because I didn't have hot flashes anymore, and I thought I was just finished, and I was good to go.
Mm-hmm. And what brought you back?
Well, then when I've always worked out. I've been working out since I've been, for 25 years. And
you weight training, you do a little bit of everything, right?
I just do, I'm fitness, I just, whatever the class of the day is, and just do a little bit of everything, try to stay healthy. And starting around in my 50s, I just started getting super tired, super achy. My workouts weren't fun anymore. They were just work, and I was just feeling miserable. And the last couple of years, I would literally come home and have to take a nap. I was exhausted. I didn't get that rush. I didn't have those happy feelings. I mean, just overall, everything was just humdrum in my life, and I couldn't believe it. You know, I thought, since I worked out for so many years and I eat healthy and everything else, not to mention I'm gaining weight, that why aren't I doing great?
So nothing changed other than you just didn't feel right and weren't motivated.
Yeah, it just, everything started changing for the worst. And I kept hearing you on the radio thinking, I'm going to call, you know, and...
You're busy, you got a bunch of stuff you're doing, so
yeah. And I thought it would be too expensive. You know, I just had a lot of things in my mind thinking.
So what finally made you make the phone call to come in?
Oh, I just couldn't take, you know, I'm like, I was tired of being sick and tired.
That's awesome. That's awesome. So, and when she came in, basically what we do, your first visit, we sit down, we talk, and kind of see what your goals are. And I know you were...
I got to meet you, and I was really surprised about that. I didn't think I would have my appointment with you. I was like, yay.
I think you came in from the gym, actually.
Yeah.
She's hardcore.
It's kind of like my uniform of the day.
But, you know, we sit down, we talk with the person, see what their goals are, see kind of where they're at, and then, you know, do blood work, because the blood work never lies. You know, and we did blood work, it came back, and you had all four things. I think you had DHEA, testosterone, pretty much everything. And that's what happens to females. Basically what menopause is for a female. You guys get thrown off a cliff, and you go from having all your nice hormones and everything's good to having nothing. So we ended up treating you, and you're doing the estrogen gel and testosterone gel, and I think you're doing DHEA also. I don't know if you're still taking that or not.
Yeah.
Okay. You know, and you're doing all that, and how do you feel?
I feel so much better. But I want to backtrack just for a second before you go, because I was so relieved that I was deficient in everything, and there was a reason why I was feeling so horrible, because then I had hope. So what was that question you asked me? I'm sorry.
Well, and what you're saying, it happens to a lot of people. They'll come in and they know they don't feel right.
Yeah.
You know, they know something's wrong. And I hear that all the time, man, I really hope I have a hormone issue, because...
Something, right. I hope
I
there's
know I'm
something
okay.
that we can fix.
Correct. I hear that every single day, honestly.
Yeah.
When people come in and tell me, I really hope I find something on here.
Yeah. And
You know,
I was so impressed by your knowledge and your enthusiasm and your fit and everything else. And I that was important to me, because, you know, I didn't want to go to a doctor that just sat there and wasn't, you know, really up on things, you know, just kind of guessing. And you were just so knowledgeable about everything. And it took about 6 weeks before things started happening. I think I talked to you after about 3 weeks, and I was getting, when's this going to happen? When's it going to start?
it does take time, unfortunately, yeah.
You know, you said, hang in there. And somewhere, I run on the weekends with my best friend, and a year ago we were running, you know, like 2 or 3 miles less. Neither one of us could keep up, and now we're running so much more and faster. And then it's like, looking back, whoa, I guess the hormone therapy is happening. It's like you don't notice it right at the moment.
Right.
You know, and then all of a sudden you're like, I'm feeling pretty good, you know, and I'm getting stronger, and I just,
Keep
my
your butt
moods
again.
were
Yeah.
better. Everything.
Yeah. And a lot of times you don't realize how bad you feel until you're fixed. But I always tell people, when you're on hormone replacement therapy, it should be night and day. If you should feel it for sure. It's not something you do and you're like, like you take a vitamin, you don't know if you really feel a vitamin or not. For some people, but hormone replacement therapy, if you're deficient, should be a game changer. You know,
Yeah.
so. You know, and at Buckeye, the way we treat it, too, is it's 50% your labs and 50% how you feel. You know what I'm saying? So it's important that we have lab values that are good, but it's also important you feel good, because feeling good is a symptom of actually being good and being healthy.
Mm-hmm.
So you know, it's a juggling act between the two, but we want to make sure that when people are doing this therapy, not only are their labs good, but are they feeling a lot better? You know, and you know, someone like you motivates other people to come in. I mean, it's a good thing. You feel better. And it's going to help you live longer, too. It's going to preserve your joints. You know, we do at Buckeye, we specialize in, you know, a lot of joint injuries and spinal stuff, and we do stem cells and everything. But even people that get stem cell procedures, you got to get your hormones checked, because even if we put stem cells in somewhere and we regrow tissue, if your hormones are deficient, you're going to wear that joint right back out.
Yeah.
You know, so it's very essential if you plan on being around for a long time to get your hormones.
Well,
balanced.
also, I was, you know, my knee hurt, my shoulder hurt, my back hurt, everything was hurting. And once I started the hormone therapy, and I was motivated more to stick with my healthier eating plan because I was feeling better. Because when you feel bad, you know, you eat, but everything's bad. So as I was feeling better, I was able to take charge of my life better. And I used to live on Advil. I mean, I don't have the aches and pains that I did. I mean, I just cannot even believe it.
That's awesome. And that could be, testosterone is one of the body's strongest anti-inflammatories, and estrogen is also very important for what they call osteoblastic, which is cartilage regrowth and reformation. So if you're a female and you've been through menopause and you're not on bioidentical hormones, you're going to have aches and pains. You're going to have osteoporosis. You're not going to be motivated. I mean, you're going to be foggy, foggy thought. There's all this stuff that you don't have to have.
Mm-hmm.
And, it's very affordable. I mean, pretty much anyone can afford to do this properly. It's not super expensive because, bioidenticals just aren't expensive. So there's just no reason to suffer. And if you're sitting listening and say, well, maybe I'm just getting old, you don't have to feel old. That's the thing. You don't have to feel old. You don't have to have these aches and pains.
Right.
I'm gonna cut the break, and we're gonna come right back. We have to do the commercial. We can probably, I think me and you could talk for a while. But this is Dr. Buzz with Buckeye Physical Medicine and Rehab. BuckeyePMR.com is the website, and we'll be right back. Sorry, I have to cut the commercial one time.
Yeah, sorry about that. No, because I was going to say, being an older mom and then having the twins and keeping up with them, I was not ready for this feeling. Coming home and taking a nap, I never did that.
Kids don't.
You can't do that.
It's not an option.
Not an option.
Not an option.
No, and I've never been a napper,
No naps. Are you ready? Ready? You
only got about 9-10 more minutes. Ready to roll?
Yeah, we're cool.
Okay, here we go.
Hey, this is Dr. Buzz. I'm back. Buckeye Physical Medicine and Rehab. BuckeyePMR.com is the website. I'm here with TJ, and she has two younger. You have twins.
Yes.
But that's a special challenge, I'm sure. And they're, you said 11 and a half?
12 and a half.
12 and a
Almost
half,
13. Sorry. Tweens.
And you were talking about, you were coming home and you were just shot.
I was shot.
And I know I have an 11 and 13-year-old. When I come home, it doesn't matter. Like last night I worked till 9:30. And I got home, and they're expecting to be entertained.
Mm-hmm.
So, chilling out's not an option.
Right.
So, but, I'm on hormones, obviously, myself, and I'm good to go until whatever time it is, I'm ready to roll. So, with kids, that's important,
It is so. I feel like I feel 10 years younger. I really do. I feel like I'm getting my life back.
That's awesome. That's awesome. So, you mentioned aches and pains got better. How about sleep patterns?
Oh, God. I'm sleeping like a baby. I can't, honestly, I really am.
And that's one thing. People get older. When people get older, they just assume I'm just getting old, that's why I don't sleep good. That's hormone deficiency.
Mm-hmm.
So if you're not sleeping good, you got to get your hormones checked out. And for females, it's usually progesterone or testosterone, a combination. In males, it can be testosterone growth. There's different things. We check all these things, but if you're sleeping bad, if you don't sleep good, number one, it makes you tired, and then it usually affects your workouts, which affects your metabolism, and then you put on weight. Like all this stuff cascades and builds on itself, and it doesn't really have to.
Right.
So, now what's a typical day for you? You get up, you're busy, you have a lot of stuff going on.
Oh, I hit the ground running just like everyone.
You work out in the morning, afternoon?
I work out in the morning, and I never stop working out. And I've lost, probably 12 pounds. Part of it's, I know it's a combination of the hormone therapy and, because I've died. Even when I ate bad, I ate better than most people I knew.
Mm-hmm.
And I just kept getting bigger, and it was just around the stomach area and like the back fat, and it just was driving me crazy. Because I work out hard. So since the hormone therapy, I definitely.
You think it's a combination of the hormones are helping,
difference.
but also just the motivation to work out harder?
I'm working out the same, but I just feel like I'm just starting to the meltdown.
Yeah, you look skinny.
My workouts are working.
That's awesome. That's awesome.
Yeah.
So if someone's listening to the show, you know, and they've canceled 3 appointments like you.
Don't do it. And the other thing I want to say about taking the blood, when I was on hormone therapy before, they weren't having me come in and recheck and tweak, you know, how you guys have kind of tweaked here and there and checked levels and asking how I'm feeling. And that's really important to me because, and I want to be a part of my my therapy. You know, I want to know, hey, how are my levels? You know, what's going on with that? You know, so I can understand it too.
Right. Right. Yeah, and there's no cookie cutter on hormones. It's not like, okay, you're a female, you get this dose of this and this dose of that, or male, the same thing. So every plan at Buckeye is custom because everybody metabolizes this stuff different. You know, you could have 10 people the exact same weight, the exact same age, the exact same hormone profile, and they all have totally different dosages. Mm-hmm. So, you know, at Buckeye, usually going to come in the beginning, we'll do blood work. If you're a female and you're on creams and gels, we also do saliva testing. You know, so but basically you want to do it at 1 month and then every 20 weeks, and then it's also important we talk with the patient, see how they're doing. Mm-hmm. You know, and usually half the patients probably have my cell phone. They call me on my cell phone and say, hey, this is going on, or that's going on, and that's fine. I love it. This is my passion. But we tweak it until we get it right. You know, and sometimes it takes a little bit. It usually takes at least 6 to 8 weeks to feel anything. Mm-hmm. I know some people are impatient.
Yeah,
you know about that, right?
Me.
Yeah, but most are, which is understandable. You know,
instant gratification.
Yeah, but around that 8 weeks, it should be really noticeable. And if not, then we got to do our work and tweak things and do whatever we got to do to make them right. So, so a couple things just real quick. So if you're listening to the show and you think you're on hormones. If you're getting it from a doctor's office who doesn't do anti-aging or specialize in bioidenticals, it's probably not, even though you've been told it's a bioidentical. If you're on Premarin, Senestin, Estrotabs, S-Trace, these are all synthetics, and there's bad. I mean, really, what you can do is when you get the prescription, look at the contraindications, and if there's a bunch of bad side effects, it's a drug. Because on a bioidentical, there are no side effects, so we don't even have to put on the directions anything bad, because there is nothing bad. So if you're getting a medication and there's all these bad side effects, you're on a drug that mimics a hormone. You're not doing hormone replacement. You're just taking a drug to mask a symptom. Very unsafe, very unhealthy, not anti-aging, and not the way to do it. Bring your stuff when you come in, and if you're not sure, bring it in. It doesn't cost you anything for a consultation. I'll sit down and I'll talk with you. And if there's something we can do that's better, I'll shoot you straight and tell you how to do it. But I strongly recommend all males and females. Females, once you get through menopause, every female should be on hormone replacement therapy.
That was the other thing that you explained that I didn't understand. That it was more important for me to be on bioidentical hormones after the menopause because I thought it was just during.
No,
and then I
very
was good
important.
to go. So that, I mean, I'm going to stay on them for the rest of my life.
Yeah, because what happens to females in particular with estrogen, females need estrogen. That's what makes a girl beautiful. If you don't have estrogen in your system, your estrogen receptors shut down. So you really want to keep that estrogen going and keep it in your system so the receptors stay open so you have all the benefits of estrogen. So it's essential for females, as you said, don't just use it to treat a symptom of hot flashes through menopause. It's something, you need estrogen for your skin, for your hair, for your joint health, for all this stuff. If you want to, be in your 60s and 70s and even 80s, exercising and getting around, it's going to be essential. If you don't have hormones, you're going to have joint issues, you're going to have aches and pains, you're not going to have energy to work out. And I know a lot of people say that, when they want to retire, they want to enjoy their retirement. You can't enjoy your retirement if you have no energy and you're all ate up with arthritis.
Right.
So what's the sense of working your whole life really hard to not be able to enjoy when you can finally chill out?
I agree.
So, well, I really appreciate you coming on here today. Do you have any final advice for anyone listening?
Do it.
Just do it.
Just do it.
Just do it. Get your blood work done. Check out our website, though. BuckeyePMR.com is a website. A bunch of radio shows are on there, and come get your blood work done. Like I say it every time, but I mean, every person, every female through menopause should be on hormone replacement therapy. And every guy, once they get to 35, 40, or if you're suffering with, aches and pains, terrible sleep patterns, lack of energy, low libido, these are all signs that it could be hormones. And I think I mentioned on the last show, too, it's crazy. It's not even an age thing. You can be a younger guy or girl and have hormone deficiencies. So a lot of guys and girls will come in and they'll have all these symptoms. They'll say, I went to my doctor and he wouldn't even test me because he said I'm too young. You're never too young to get tested, and if you don't need it, we don't do it. And unfortunately, what they do with a lot of females and males that are hormone deficient when they're younger, instead of even testing the hormones, they put them on antidepressant medications. They say, oh, you're just probably depressed. So here's some Wellbutrin, or here's this or that, which makes your hormones even worse. So, you know, if you're on an antidepressant medication, and maybe it's not depression, maybe it's hormones, get your blood work done.
Yeah, my mood is so much better. I mean, I was getting a little hopeless there for a minute, you know. I was getting down, and I feel much, much better about that.
Now you're kicking butt.
Now I'm kicking butt.
All right, well, once again, thanks so much, TJ. This is Dr. Buzz with Buckeye Physical Medicine and Rehab. Check out our website, buckeyepmr.com. Until next time.
I'm sorry if I talk too much.
Oh, she's great.
What's the point of it? We wanted you to. There's no such thing as talking to
I guess I'm feeling a lot better.